What's multiple sclerosis?
Multiple sclerosis? Okay, so multiple sclerosis is a neurological disorder where your immune system doesn't recognize your own tissue and it starts destroying it, right? So there's something called a neuron, which is the cells of the nervous system that conduct impulses from the cell body or the soma through the axon, and then the axon terminal, and then the synapse, which is a gap between the next target tissue, right? And so the way the nervous system works is that it's always conducting electrical impulses through the axon, and the axon serves kind of like the wires inside of your cell phone charger. And what does a cell phone charger have around it that protects it? That white plastic film or whatever the material is. Well, your axons have something very similar. It's made up of fats, lipids. It's called the myelin sheath created by Schwann cells. So that protects your axon. Imagine I'm the cell body, my arm is the axon. It's conducting impulses this way, and then my axon terminal releases a neurotransmitter. In particular, you have acetylcholine, you have dopamine, you have norepinephrine, you have a lot of. But my point is, this is how electrical conduction occurs, and that neurotransmitter latches on to the receptors of another particular tissue, and that's how the electricity is conducted, so that muscle, that tissue can do its thing. In multiple sclerosis, your immune system starts attacking the myelin sheath on the axon, and that destroys the conduction. So imagine like your cell phones, right? After a while, the wire, the plastic covering over the wire becomes frayed, cut, and then you have to wiggle your cell phone charger because it won't charge well. That's kind of like what happens in our system. Your sensation is altered. The conduction of movement for muscle contraction is altered. So patients with multiple sclerosis, they develop weakness. And that's the biggest point in multiple sclerosis. It also has a hard time conducting impulses to your bladder, so they're going to have urinary issues like incontinence, spasticity. They're going to have issues with bowel elimination because the muscles of their intestines aren't receiving the conduction adequately, and that's the issue with multiple sclerosis. Now, it's important for students to understand that there's another condition very similar called Myasthenia gravis. Remember I told you guys that the conduction occurs this way? Well, one of those neurotransmitters is known as acetylcholine. And acetylcholine latches onto the acetylcholine receptors of muscles, and that's how muscles contract. That's how it initiates its action potential. Well, in myasthenia gravis, you have autoimmune antibodies that destroy the receptors, like the catchers of acetylcholine. And so the muscle is not receiving what it's supposed to receive, hence the muscle does not contract adequately. Now, multiple sclerosis and myasthenia gravis are very similar manifestations. And the same thing goes with Parkinson's or amyotrophic lateral sclerosis or ALS. But don't get those confused, and I'll discuss those in a later video as well. But my point is, myasthenia gravis, multiple sclerosis, they're very similar in that particular fashion because the conduction of electricity is altered, both by autoimmune issues. What you guys need to know is sometimes to differentiate the two. Well, we give a shot to the patient, an injection called, it's a tensilon test. And what we do is we give a slight amount of anticholinesterase, anticholinesterase, which is a medication that stops an enzyme from reabsorbing the acetylcholine that's left behind in the synaptic cleft. Normally, our body is really like conservative when it comes to its elements, and it wants to reabsorb, recycle. And so whenever the neurotransmitter is released and it gets onto its muscle, it conducts its impulse. Well, whatever's remaining in the synaptic cleft gets reabsorbed by an enzyme, and that's your anticholinesterase, right? Well, if you have myasthenia gravis, you don't want to reabsorb the acetylcholine. You want it to stay there so it can eventually get to the muscles and do its thing with the available receptors that are left over. So what we do is we give a shot of anticholinesterase, and for about 5 minutes, the patient's muscle weakness will improve. And that's really how we differentiate multiple sclerosis and myasthenia gravis. There's also something called ptosis, which is when your eye droops a little bit, and you as a nurse will do the assessment. You tell the patient to look up, and then the eye will droop a little bit. That's an indication that the conduction from the neurons to the muscles isn't as adequate. And that's the main difference between both myasthenia gravis and multiple sclerosis.